Nowadays, teenagers, people in their late 20s, early 30s, they have those strong knee pains. Why is that happening?
That's because your muscles aren't strong enough and you've pushed it beyond their capabilities.
So, how much is enough water?
I think the minimum that you should be taking is at 2.5 liters a day.
Many doctors, and you did the same thing, get trained abroad, but then they come back to India to practice. How difficult or easy is that transition?
It's quite a grind,
Yes.
and it's a difficult process. And to be able to achieve that is not easy.
In your journey, which is that one case or surgery that appeared to you to be the most complex?
The one athlete that I can probably think of in that respect is Vinesh Phogat.
When you cure the ligaments, what exactly are you doing?
Take the hamstring tendon or the patellar tendon or the quadriceps tendon, make that into a ligament and then fix it in the knee.
Music you'd love playing in the OT if you were up.
A lot of surgeons like music in the OT.
Another thing that's really spoken about is these meniscus tears.
Someone who's young and who's playing sports may twist his knee significantly and may land up with a meniscus tear.
And as you said, even at the age of 92, if people can recover. Welcome to another episode of my show. We generally tend to believe that orthopedic issues related to our joints, our bones, our ligaments, are just for the athletes. But that's not true. These issues can happen to any of us. They can arise due to normal wear and tear. They can arise due to some over-enthusiasm at the gym, due to some wrong habits that we follow on a day-to-day basis, or just due to an accident. But when any of these issues occur, it can just flip our life overnight. And the cure? The cure is not just about the surgery. It's actually about finding the right guidance, the right diagnosis, the right treatment, and then our own resolve and grit and patience to recover from these injuries. Today, I have the pleasure of speaking to someone who is the go-to specialist in this field for any top athlete in India. And of course, for all the non-athletes too. Someone who's enabled so many people to not just bring back their knees and their shoulders back on track, but in a way, bring their life back on track. Someone who's changed the course of Indian sports from behind the scenes by being a part of the recovery journey of many top athletes. Dr. Dinshaw Pardiwala. So let's dive into Dr. Pardiwala's world of precision, performance, and healing. Dinshaw, welcome to my show.
Thank you, Chanda. It's a pleasure to be here.
It's my pleasure too, because I know that you always believe that your work should speak in your clinic and in the operation theatre, and you don't generally speak about it on the camera. But believe me, the way you've transformed lives of people through your work in the clinic and OT, I think you will today again transform lives of many more people who will listen to you and learn from your experience. So let's rewind a little bit, Let's tell us what was young Dinshaw like while growing up. Did you always know you wanted to be a doctor, or did that passion kind of evolve over time?
I think it evolved over time. As a child, my passion was really sports.
Oh,
I loved
okay.
sports. I played a whole load of sports.
Like?
My school encouraged me to play many sports. I swam, I played badminton, I played cricket and hockey and rugby and football and gymnastics. And being a jack of all trades, unfortunately, I was a master of none. I was also fortunately quite decent in academics. And so as the years went by, biology became my subject of choice.
Okay.
My mother's family came from a family of doctors.
Okay.
And so I slowly veered towards medicine as a profession. And once you, as a medical student, you get exposed to all of the different specialities. Having been in sports, it just automatically, orthopedics came as something that interested me the most. And when I took up orthopedics primarily with the aim that I'd get into sports orthopedics. That was still quite a nascent branch in India. And I thought that maybe sports orthopedics was something that I could make a significant difference in. So that's how I slowly veered into that. So it came from sports, then went into medicine, then went to orthopedics, and then sports orthopedics.
So now we can understand where the inclination for sports medicine came from. And you, of course, you did your MBBS and MS in India, but then got trained in, few of the best institutions in UK and US, and then you came back to India. So what brought you back to India?
I think opportunity more than anything else. You have a lot of facilities, of course, in the US and abroad. And I think earlier on in my training itself, I realized that sports orthopedics was deficient to a large extent in India. At that point of time, 25 years back, sports was also growing tremendously in India. Besides cricket, all of the other sports were also getting some amount of recognition and a push. And I thought that the deficiency really existed in sports science. Athletes could only do so much, but if they do have an injury, then getting them back quickly after an injury required proficiency in sports orthopedics. And I felt that if I was in the US or if I was in the UK, I'd be just one of those many who are doing a good job. But here I could make a real difference. And when you can really contribute and then you can make a difference in athletes and teams' lives and their careers, I think then you can learn more and then you can contribute more.
Absolutely. I think you've, as I said earlier, in a way, shaped the path of Indian sports by quietly behind the scenes working on these recovery journeys. But before we talk about the elite athletes, let's talk about the regular people in general. What are the kind of issues that people face when it comes to their joints and their bones and so on?
For a general orthopedic surgeon, the most common thing is either a traumatic injury. So lots of people fall, they break bones, children fall and break bones, or you'll end up with degenerative joint diseases. That means as you grow older, your parts of the body are going to get older. And in the joints, it's primarily wear and tear. It's what we call as osteoarthritis or degeneration. India, it's most common in the knees, but it's also well known in the other joints. So as we grow older, our joints start wearing out. With the wear out of the joints, our mobility starts getting hampered. Pain starts appearing. And in the past, that was taken as more or less a process of aging and accepted. But today we know that quality of life matters and everyone wants a better quality of life. And even when you're 80 and 90, people want to be active. And so we've got means in orthopedics today to manage that. Unfortunately, a lot of these are surgical means, but over time, hopefully it'll also come to medical means. And if our preventive programs are good enough, we may never require so many joint replacements as we're doing right now, if we can prevent that process of osteoarthritis. I'm sure we can't reverse aging and we can't prevent aging, but we can make sure that our joints are capable of at least taking care of whatever loads are required at a later age.
But you spoke about aging, but what age is aging? Bone density issues, they arise over a period of time, and especially for women. So what is the right age when people should start screening about bone density?
Sometimes in certain families, that osteoporosis. So when you've got softer bones, weak bones, we call that osteoporosis. And when you've got joints which wear out, we call that osteoarthritis. Now, in some families, we know that everyone in my family landed up with osteoporosis earlier on. And everyone in my family starts landing up with fractures, with small falls and minor injuries causing falls and then causing fractures even in their 50s and 60s. So if you're aware that your family has a history of osteoporosis, I think it's worthwhile to start monitoring for it and screening for it early on.
Okay.
And that early on in women at least would mean 35 to 40.
Oh,
so as early as 35 to 40, start getting a bone density evaluation done, seeing what your bone density is like. If it's normal, great. But if it's not, then preventive care is always more effective than treating it. And that preventive care would mean two things. Making sure that you're taking nutrients. So vitamin D is one of the important nutrients to just make sure that your bones are strong. but also at the same time, lifestyle changes, exercise, some amount of loading, some amount of exercise is good for the bones. In our body, form follows function. So if we use it, then it's going to be effective. If we don't use it, we're going to lose our muscle strength, we're going to lose our bone strength and density. And so over time, that's going to build up into osteoporosis. The same with joints. There's always an optimum. If you overuse it, like an athlete does, you're probably going to land up with wear and tear earlier. But if you don't use it at all, then again, that's bad for you. Those joints are not going to be effective, and they're not going to allow you to do all the sort of normal functioning that you want to do at a later stage.
But also nowadays, teenagers, people in their late 20s, early 30s, they have those strong knee pains, they have other issues, related to ligaments and so on. Why is that happening?
I think there's a dual process here. Some children, when they're growing up, are not exposed to sports, and they're not exposed to playing a lot of playing and activities that require loading. They're primarily studying in that initial phase. And then later on, when they get that time in their late 20s and 30s, when they suddenly start playing sports and they start playing football on turfs that they're not used to, your body is not conditioned enough for that sport, and then you're going to have a higher incidence of injuries. So if you see lots of children and lots of young adults landing up with ACL tears, that's primarily because their ACLs haven't been loaded in their formative years. And then you suddenly start playing a sport without the fitness demands that are needed for it, without getting conditioned for it. So you're not physically fit for that sport. And then when you play it, a minor twist or a turn is going to snap your ankle ligament or your knee ligament, or you'll end up with some muscle sort of tear. So that's one aspect. Now, there's another aspect where you find that sometimes there's just overuse. There's some children who are keen on sports, but they're not really doing any physical fitness, and they're just going ahead and playing tennis each and every day, or they're going ahead and playing badminton each and every day. And if you're not looking at the physical fitness part of it, then there's going to be an overuse injury. You've used that muscle, you use that joint way beyond the capabilities of that joint, and then you will land up with aches and pains. So knee pains without any structural problem. Nothing's broken or torn, but you're getting knee pain. And that's because your muscles aren't strong enough and you've pushed it beyond their capabilities. So that's, again, unfortunately, more common than we'd like it to be.
So you should not underuse your joints and bones and muscles, and you should not overuse them.
Absolutely. So as in anything in life, there's an optimum.
That's right.
You overdo it, and that's bad. And if you don't use it, then again, that's bad. So there's always that optimum. And that optimum is different for different people.
That's what I was going to ask you, that how does one realize what is the optimum?
True. So that optimum is different for different people. For a recreational athlete, that's different.
Okay.
For a competitive athlete, that's different. In a cricket team itself, we try and see workloads. The workloads are different for fast bowlers. The workloads are different for spin bowlers. Workloads are different for a wicket keeper or a batsman. So different demands require different sets of physical fitness. Someone may require more strength than endurance. Someone may require more flexibility. So you need to try and see what is that person's goals. Is he in an elite sport? Is he doing it recreationally? Is he doing it for fitness purposes? And then see what's that optimum. And even amongst individuals, there's so many of us that are different. Someone goes to the gym and builds up his muscles within a few weeks. And there are others who go and then, they're struggling for months. And that's just because of our different body types. And so sometimes identifying where you fit and what's optimum for you is important. I think it's critical, because if you don't, you'll realize that only after you've had an injury. And it's always better that you realize that as a preventive measure before you've actually landed up with that injury.
So again, that's why, is a lot of it got to do also just with lifestyle. The people sitting for long hours at the desk, and obesity, and sometimes lack of exercise and so on. Are we kind of unknowingly pushing ourselves to these long-term damage, so to say?
I think so. So if our bodies were meant, as the human bodies evolved, we have bones, we've got joints, we've got muscles. We were meant to be active. We were meant to be moving around. We were meant to use all our joints. And if we don't use it, then you're going to have weakness, disuse, atrophy, which means weakness coming into the muscles because of not using it. And all of that process starts off early. So if you're going to be primarily sedentary and you're not going to use your bones, you're not going to use your muscles, you're not really going to use your joints, then over time, those muscles are going to become weaker and they're going to become less conditioned. And when you do really need the use of them, you go for a vacation and you suddenly have to walk in London for 10,000 steps and you're used to only 1,000 steps, you're going to find that that's going to be extremely difficult. And if you keep doing that, you'll probably land up with an overuse injury or a stress fracture or something like that.
Few habits that people should follow to get that right kind of fitness, as you're saying.
I think make sure that you're moving at all points of time. So use your joints, move around.
Okay.
The simplest of exercises. If you're not someone who's even used to exercise and who even doesn't like to exercise, someone who doesn't like to go to the gym, just walk.
Okay.
If you can swim or cycle, just swim or cycle or walk. And that's just building up your capabilities of the joints. That also is a good cardio exercise and ensures that your heart and your lungs are fit. If you want to do something beyond walking, and especially if you're looking at preventing osteoporosis, then some sort of weight training is also good. You don't necessarily have to do it in the gym. You could do it at home. You could buy yourself simple weights, some TheraBands, which are elastic bands and resistance bands, and start putting a bit of load on those bones and joints. So as I mentioned earlier, in our body, form follows function. So if we do use our joints, they're going to get stronger. So if every day you do put a little bit of load on them, our bones will remain dense and strong, our muscles will remain strong and efficient, and our joints will remain supple. So I think trying to get into a minimum, a basic fitness program is going to help everyone. And then once you get into that, you may exceed your expectations, and then you may say, okay, I want to do a little better. Then you could think of stepping it up. But if you do want to step it up, I would strongly suggest that you get some professional help. Meet a physiotherapist, meet a fitness trainer, a coach, someone who can assess your body and see what's optimum for you so that you don't inadvertently land up with just an overload because your body was not ready for it.
So is there something like too much fitness? Because also, as you're saying, there are a lot of people who are today now more focused on intensity rather than the technique, even when it comes to the gym. All these high intensive trainings, even running long marathons or lifting very heavy weights, are they doing a little bit more harm than good to our bodies?
Absolutely. So, there's always the right amount, and that's the optimum. And a lot of people don't realize that over-exercise is bad for you. Anything that's good in excess is going to be bad for you. And so if you already have a little bit of wear and tear setting in, and now after all of these years of hard work, you've become a CEO in a bank, and you suddenly think that, no, I want to get into running. All my friends are running, so I should start running. You're already 45, you're 46, and you start running at that point of time, and you've already landed up with a little bit of wear and tear. You could just accelerate that wear and tear, and maybe running is not the right exercise for you. Now, someone needs to assess that, and you need to be informed of that before you start it off, because you start running, you enjoy running, and you go from your dream run to your half marathon, and then you go for your full marathon, and you're thinking of an ultra, or you're thinking of, something bigger, and then suddenly you find, oops, I've got severe pains and I can't go any further. And it's the damage that you've done in the last 4 years or 5 years, which could certainly have been preventable. Or someone who suddenly starts off going into a CrossFit program, and starts jumping excessively and starts, damaging their joints without realizing it. You also have some children, some teenagers who just go to the gym. They want a better looking body. And so they start pushing weights and they start pushing way beyond their capabilities and then land up with tears in their muscles, stuff that was certainly so avoidable and so preventable. And so having the right balance is important. And sometimes you may not realize that. So therefore having a coach or a physio or an athletic sort of coach or a trainer with you always helps you in that process.
So you're saying you should combine it with a little bit of screening, like, start watching your bone density and so on, and right guidance with the coach or your trainer so that you know that you are at that optimum level.
I don't think everyone requires that. So if you're just going to go into, say, a morning walk, or a bit of a swimming or a cycling thing, I think that's great. You don't require any help. But if you're going to think of ramping it up and trying to increase it, and you're trying to do it on a regular basis, You're going to start playing sports later on in life, which you haven't done as a child or you haven't done as a teenager. Then it's always worthwhile to get a little bit of an evaluation done just to make sure that you're not harming yourself in the process of trying to get better. We see so many enthusiastic middle-aged Indians who've heard a podcast or have seen a program and who say, I'm going to get fit, and who suddenly start doing way beyond their capabilities and then land up with an injury that sets them back. And they really wish, why did I get into this? So it's always best that if you're starting something new, go slow. And then if you're really thinking of doing it on a regular basis, then get a basic evaluation done, get a little bit of help just to make sure you're on the right path.
Any other simple habits like dietary habits or something that, should be followed to just keep it, increase the longevity of our bones and joints and muscles?
So our weight-bearing joints, and that's the knee, the ankle, the hip, and also the back, we know that there's a strong correlation between body weight, that's BMI, and wear and tear. So if our body weight is more and we're obese or we are significantly obese, then we know that our wear and tear in these weight-bearing joints is going to be significantly more. If your body weight is more and you start off with loading exercises and jumping and high impact stuff, that's going to be even worse. So sometimes, someone's put on weight post-pregnancy and you think, I'm going to lose that weight, and you suddenly get into an aerobics class and start jumping. You've not used to jumping and you suddenly are doing 1,000 and 2,000 jumps in that process of reducing your weight. You will reduce your weight, but in the process, you'll also damage your joints. So there has to be a slow process of, exercises that are not excessively having impact or load. You get into slightly better levels of fitness. You decrease your weight with walking, swimming, cycling, and then think of getting into impact sort of exercises. So body weight is important. Now, how are you going to manage body weight? Preventively, it's not just exercise, it's also diet.
Right.
And I think that's really critical. If you're looking at fitness, diet plays a major, major role in that. And you don't necessarily have to go to a nutritionist, to try and sort that out. That's not rocket science. The amount of calories you put in and what you eat is going to make a big difference on what your weight is. And you could just make simple dietary changes, initially. Simple stuff. If you're looking at fast foods and you're looking at unhealthy diets and you're looking at a lot of sweets and sugar, you can be certain that you're going to put on weight. If you're exercising at the same point of time, then that's different. That's not a problem. So if you're exercising excessively, you're burning a lot of calories, then you can eat probably whatever you want. A well-balanced diet is okay. But if you're not exercising, then you certainly need to be aware of what you're putting in because you're not burning that out, and that's going to result in more fat, more weight, and that ultimately is going to result in more problems on your joints.
Other habits as well, for example, something like a simple thing like choice of footwear. Does that matter? High heels, no heels, flip-flops, so much is talked about. How does that
in the initial years, if you don't have a foot problem, if you don't have a foot abnormality, you're not born with a flat foot, you're not born with a slightly high-arched foot, it shouldn't matter so much.
Okay.
But if you're going to be wearing high heels requires a significant amount of strength in your feet, in your legs.
Right.
And if you don't have that strength in those muscles and you're going to wear high heels, then over time you're going to develop deformities in your toes, in your midfoot, and in your legs. So that's going to happen. Now, what's best for you? So if you think that high heels is something that you do want, that's great. But then you work towards making sure that your legs are fit enough for that, and then work through. Our feet were never made for going up on 6-inch heels.
Yeah.
But if you're going to do that, you can do that, but you need to make yourself physically fit for that.
And what about these supplements, the calciums and the collagens and all that? What is your take on that?
Yeah, so I think that's quite a debatable and controversial topic today. How necessary are supplements in day-to-day life for a normal person, for an athlete, for an older individual? And there's a lot of debate, and you've got strong arguments on both sides. But I would say to the normal person, make sure that your vitamin D is okay, your vitamin B12 is okay, because those two, certainly we have enough evidence to show that those two deficiencies will create problems. If you're not someone who's heavily into sports, then maybe the other micronutrients and other things may not really be so important. But if someone's concerned about it, then it's worthwhile to at least get a routine checkup done. There's so many executive health checkups which are being done. All of these would pick up these deficiencies. And if they do pick up these deficiencies, then it's worthwhile to start taking nutritional supplements for that. I wouldn't recommend young kids just popping in magnesium tablets and taking creatine and all sorts of stuff just because they've seen some online videos which say that they're good for them. So I think you need to be a little careful. Sometimes not all of the supplements are safe. Not all of the supplements have exactly what's written on the bottle that's there. So you need to be a little careful of what you're putting inside your mouth. I think athletes are aware of that. Athletes today are very well aware of that because athletes get tested and they know that some of these supplements may be a little adulterated.
But they are also, always having protein shakes, and many of them may be adulterated.
And some of these may be adulterated. So all of our elite athletes who will get checked routinely for substances are very aware of this. But the recreational athletes may not be that aware. The regular gym goers may not really be that aware. Someone tells them take this supplement and they take it, and then that contains stuff that may not be so good for their body.
So what you're saying is that when it comes to prevention, the balanced approach is what we have to take.
Absolutely.
Whether it's in your diet, whether it's in your exercising, whether you want to consume,
whether it's in your investments, whether it's in anything in life, if you don't have a balanced approach, you're risking problems.
Lot is spoken about ligament tears. Now, what are these ligament tears? How do these injuries happen? But more important, when you cure the ligaments, what exactly are you doing?
So what's a ligament?
Yes.
A ligament is a structure that connects two bones together.
Okay.
So when we've got a joint, like say the knee joint, you've got a bone above and you've got a bone below.
Right.
And so that is a joint. It's like your door's joint. If you didn't have the hinge in the door, that door would just fall down.
Right.
So the hinge is your ligament. So exactly that. In our knee, we've got multiple ligaments and these hold all the bones together. So these ligaments are elastic and therefore will allow movement, but the ligaments also ensure that there's not excessive movement in a particular plane.
Okay.
So take, for example, the most studied and the most well-known ligament, that's the ACL or the anterior cruciate ligament. Now this ACL is a ligament in the knee. It's a ligament that holds the two bones together and it's responsible for the rotational stability of the knee.
Okay.
Now, you could land up with an injury in the ligament by either falling off a bike or some traumatic incident, or you could actually even break it without any it's a non-contact injury as we call it. So you're running in a straight line and then you take a sudden turn and your muscles weren't ready for that turn. You went beyond the capabilities of that ligament and that ligament snaps.
Okay.
Now, when that ligament snaps, it may not cause too much of a problem to normal people who don't want to run and jump and play. But for an athlete who needs to run, needs to jump, needs to play, deficiency of that ligament is going to cause them what we call as instability. As soon as they run or jump, they'll find that their knee is buckling. And because their knee is buckling, they will fall and injure something else, or they just can't go fast, they just can't jump. Now, not all ligaments require surgery.
Okay.
A lot of our ligaments in the body will heal on their own. So we just put in a brace or we put in a plaster or we rest it and certain ligaments will heal.
Okay.
But some ligaments are notorious for not healing and this ACL is notorious for not healing.
Okay.
So if it doesn't heal, then we require a surgery and in that surgery we put a new ligament in there.
So where does that ligament come from?
We can take it from different parts of the body. So like in plastic surgery, if you have skin that's not here, you can take it from one part and put it there. So same way, we can take some tendons from around the knee. So we could take the hamstring tendon or the patellar tendon or the quadriceps tendon, make that into a ligament and then fix it in the knee. And it takes about 3 or 4 months for that to heal. And once that's healed, then that's almost as good as, the old original ligament. But we also need rehabilitation because we've taken it from that part of the body.
Right.
That part of the body is going to be a little weak for 4 to 6 months. So we need to work on strengthening that part. And once that's strengthened, then you get back to normalcy or near normalcy.
Another thing that's really spoken about is these meniscus tears. So, what exactly is meniscus and how does this happen and how does this get cured?
So in our knees, we've got these two structures that we call the meniscus. There's one on the inner side, one on the outer side. So the medial meniscus and the lateral meniscus. Now these menisci are shock absorbers.
Okay.
And these menisci are really important for the knee because they distribute the loads in the knee and they prevent wear and tear.
Mm-hmm.
Now, someone who's young and who's playing sports may twist his knee significantly and may land up with a meniscus tear. And sometimes you have a combination of injuries. So you break your ligament and you break your meniscus at the same time. So what do we do for these younger patients with traumatic tears? We stitch up the meniscus. So we can stitch up the meniscus and we can repair it and make it heal. And once it heals, it's back to normalcy. We may get the rare sort of case where we can't really stitch it up. It's crushed and it's completely gone. In those kind of circumstances, we can transplant a meniscus. So like you do for a kidney transplant or a heart transplant or a liver transplant, we get these cadaveric menisci that we can transplant in our patients. Now, you could also land up with what we call as degenerative meniscus tears. So as we grow older, these menisci become a little less resilient to loads, and you could land up with small little tears within them. So these degenerative meniscus tears, typically 90% of them don't require any surgery. They may cause you a little pain for a little bit of time, but then rest, physiotherapy, and you get back to normalcy. But there will be 10% of these degenerative meniscus tears in middle-aged and older patients that may require a small little keyhole surgery. We call it an arthroscopic surgery. And with that, we could restore that meniscus back to relative normalcy.
But do people even realize that they've got a meniscus tear? I mean, or they just used to kind of living with pain and thinking it's a little bit pain, I exercised a bit more. How does somebody pay attention to this?
The traumatic ones, the ones where you land up with an injury, when you're running, jumping, you're certainly going to feel a snap. So you'll know that something's off. The knee gets bloated up and swollen, and you can't walk and you're limping. So something like that is a sudden event, which certainly someone will go to a doctor for advice. But some of these degenerative meniscus tears, to be quite honest, are just a process of aging. So it's a slow, steady process, fiber by fiber by fiber breaks. And then, when that last little bit breaks, that's the last straw on the camel's back, that meniscus will completely get disrupted. And then it'll cause pain, then it'll cause swelling.
And what about things like knee replacement? We say knee replacement. I'm sure the whole knee is not replaced. What actually do you replace?
So what do we replace in a knee replacement? So in knee replacements, so we know that the bones are covered with cartilage. This is called articular cartilage. And this articular cartilage over time gets worn out. So when it's completely worn out and you've got no articular cartilage left, you've got no cushioning left, the bones start touching the bones. And when bones start touching bones, that's painful. That causes swelling. That then causes inflammation. That then causes pain. Then comes a limp. Then the bone gets a little deformed. So this is all a process of and a cascade of events in osteoarthritis. The treatment of choice for knees that are completely worn out, where bone's touching bone, is a knee replacement. So what do? It's just replacing the surface of that joint. So the cartilage which is worn out, a metallic insert is put, so that covers the entire bone surface, and it's on both sides. It's on the femur, that's the thigh bone, and you can put in a plastic sort of insert on the bone below. So you've got an artificial joint then, metal with polyethylene, that's articulating there. So since these surfaces don't have nerve endings, you don't land up with pain. And I think it's a great treatment for patients who are disabled with severe osteoarthritis. So if you've got significant osteoarthritis that's painful and is causing you debilitating sort of symptoms, then the cure of choice would be replacing it. You just change the surfaces. It's a relatively straightforward and standardized sort of treatment that gets you pain relief and gives you good function.
But as you said, therefore, the way to prevent all these is to kind of track your bone density early on, to avoid obesity, to avoid the fact that...
Absolutely. So if you could avoid getting a knee replacement done and have your natural knee for the rest of your life, then that would be ideal.
Right.
But if that doesn't happen and you do land up with a problem, then at least there's a solution.
That's right. But A lot of people come back with a knee replacement and then again put on weight, and then again is it back to square one or?
Well, a knee replacement is a mechanical part.
Okay.
It's a synthetic, it's a metal with a plastic. It will wear out over time. You cement it into bones, so there's a bond between the bone and the prosthesis. Weight, excessive activities are going to break those bonds, and what might last for 18 or 20 years may then last only for 12 or 15 years. So if you buy a brand new car, you take care of it, it's going to last you for long. You get a new piece put inside your new knee replacement, you take care of it, it's going to last you for long. But if you have excessive weight, you abuse it by running, jumping excessively, then it's not going to last you as long as it could.
You spoke about arthroscopy. So that's actually a surgery which is minimally invasive. So is that the future? How is that important for patients?
So many years back, all of our surgeries started going the minimally invasive way. And so minimally invasive means that if we have to, say, reach a joint and we have to cut the skin, cut the muscles and get deep inside, then we're causing a lot of damage and morbidity of normal structures just to approach the area that we want to address.
Okay.
And that could be in different areas. So in the abdomen, if you've got something and you can do a laparoscopic procedure, which means you just make puncture holes instead of opening up the whole abdomen, that's better. The same in the chest, the same in the joints. So all of our surgical procedures have moved towards endoscopic surgery or minimally invasive surgery. So what do we do here? For the joints, we just make 2 or 3 small puncture holes, put a telescope inside. The telescope sees everything in there, and through 1 or 2 more puncture holes, we put in instruments which achieve the same job. So you're doing exactly the same thing like an open surgery, but without the morbidity and the pain of opening it up. So therefore, your recovery patterns are much better. Your athletes are likely then to get back to near normal or normal status as far as the joints are concerned, and then be able to achieve their goals earlier. Because sports careers are short. You do an open surgery and that takes 2 years to recover, versus an endoscopic or an arthroscopic surgery that takes 3 weeks to 3 months to 6 months to recover. Then of course that's going to be much, much better for that athlete.
So this concept of reconstruction, so you don't replace something, you can reconstruct a shoulder or a knee. How does that work?
So we spoke about those ACLs which were torn.
Yeah.
So when we put a new structure in, we call that a reconstruction. So say something is broken and we stitch it up, we call it a repair. If something's broken and you can't stitch it up and you need to put something new inside that's going to replace it, then we call it a reconstruction.
Okay.
And we use the term replacement primarily for prosthetic replacement or joint replacement. So when you need to put in a metallic component, a new metallic joint or a plastic joint, then of course that's a replacement. So our reconstructive surgeries, we putting in new ligaments, putting in new menisci, putting in new articular cartilage, and trying to restore normalcy without having to change the joint itself.
And what about regenerative medicine? For all the stem cells and PRPs, what do you have to say about that?
So regenerative medicine is really a very exciting and promising branch.
So what does that do?
So we know that as we grow older, our tissues are going to get older.
Right.
And as our tissues get older, we're dealing with biological problems. So we're dealing with cellular problems where each cell is becoming older and older and older.
Right.
So when we're dealing with, say, tears in the shoulder, rotator cuff tears, the tear happens because of an injury, but there's also a predisposition. There's wear and tear that's taken place. Now, if we find that there's wear and tear, we've always tried to see, is there a means with which we can reduce that wear and tear or reverse that wear and tear?
Okay.
So that's what we're trying to do. We're trying to regenerate tissues. Now, that's cutting edge because we're really trying to reverse aging. Is it possible for us to do that? I think we're not absolutely there. It's still an evolving science. On paper and theoretically, all of these things, PRP and stem cells, they seem to be very, very good. But most of the clinical trials seem to suggest that we're not 100% there. It's not that predictable each and every time. It does work in some patients, but it doesn't work in others. So is it there and is it going to stay? I'm sure it is going to stay. Is it going to evolve and is it going to become better? I'm sure it's going to get better. But are we there as yet? I don't think so.
Okay.
I think that we're in the process of getting there, but we're not there as yet. Would we use this indiscriminately? I think no. There's specific indications where we know it works, and we should try and reserve it to only those indications where we have some evidence that yes, it's good for this. I think right now, is it being misused? I think it is. It's being used for everything left, right, and center, which it shouldn't be. Which in any new science and technology, in any new product, we're always going to try and see, can we use it here? Can it be beneficial here? And the scientists and the researchers are going to do that. And then you're going to find that, yes, it's really useful in this, but not so useful in this and completely useless in this. And I think that's the defining moment. And right now we are in that defining phase where we're trying to decipher where is it really, really useful. We've already determined that's very useful for certain muscle injuries, certain tendon injuries, but not all.
Okay.
There's a long way to go before we can say definitively that PRP is really good for this or stem cells is really good for this. And I'm sure every 2 or 3 years, we'll keep seeing more evidence that supports its usage.
It's about an exciting field to track, actually.
Exciting field to track primarily because it's dealing with reversal of cellular aging. It's dealing with faster healing. In a way, we're trying to play God and trying to get things faster than the natural way of processes. And if we truly achieve that, I think then that's something good for our patients.
So we spoke about all these forms of surgeries or treatments and so on, but I mean, that's all that the doctor can do. So much is dependent on the patient herself. And where do you think a common patient goes wrong or lacks in this post-surgery rehab?
Now, there's some surgeries that don't need too much rehab.
Okay.
And where you complete the surgery and just your normal day-to-day activities is going to get you back to normalcy. So they don't require too much rehab.
Okay.
But there are some surgeries where rehab is really important. So take, for example, an ACL reconstruction that we just spoke about. The surgery can get your ACL in there and that ACL can heal. But your ability to run, jump, and play is not just based on that ACL. It's based on multiple muscles that control the knee, multiple other areas, joints above and below. So all of that needs rehab. And if you don't do that rehab, your recovery is going to be extremely slow. So when I get a patient coming in and telling me that, we heard that Jasprit Bumrah started playing 5 months after his ACL surgery. Am I going to do that? And you say, maybe not. I don't think you'll be able to put in that kind of effort on a daily basis, the kind of dedication that goes into that rehab. Normal human beings also have to go to work and they have other, responsibilities too. So if you can't put in that kind of effort and you don't have that supervised sort of approach, then it might take you a little more time. That little more time may mean 7 months, 8 months, or 9 months. And then if you put in no effort at all, it might actually take you a year or two. I think Rishabh Pant's case, a lot of people spoke about, Rishabh Pant having gotten back after such a grievous injury so quickly. I think the miraculous thing here was the rehab that he received. So the BCCI and the National Cricket Academy, where he got his rehab done, was so tremendously good, and he dedicated himself and his physios dedicated themselves to ensuring that they can do the best and do it in the shortest possible time. That's why he's recovered so quickly, because otherwise a surgery like that would have taken certainly 18 months or maybe a little more, but he managed to do it in 12 months just because of the amount of rehab. So again, a case in point, good rehab can improve your surgical results tremendously.
But talking about Rishabh Pant's case, I mean, this was a case that was followed so closely by the nation. Tell us, what was the condition in which you saw him first, because he actually went through an accident, a major accident. So what was the condition you saw him in, and what were the challenges at that time, and how did you go about, trying to sort them?
So you can just imagine if someone's in a car and that has a high speed sort of accident where the car overturns, the body is going to take a severe beating. And that's the beating that he had. He was extremely lucky that he hadn't injured his brain, his head, his vital organs. Fortunately, all that got saved. And he did have a knee that was dislocated. And a knee that's dislocated, unlike an ACL, which is one ligament, when you dislocate your knee, you break all the ligaments. And if you break all the ligaments, then you have to do a lot of surgery to restore it back. And you could either do this in a phased manner, do it, step by step, but that's going to take a long time. And so the decision for him was that we do everything in one shot. But if we do everything in one shot, then that comes with a lot of effort from post-surgical recovery and rehab. And he was certain that that was the way it needed to be done. So a bad injury, a lot of surgery. His knee, which was dislocated, required ligament surgeries. But he had also other minor injuries in other areas that required care. His ankle, his elbow, his toe. He had a lot of skin and soft tissue injuries that required treatment. So since all of that went concurrently, we could save time on making sure that he was back to normalcy initially and then to high demand activities.
So in your view, it could have taken how long for him to recover? And he actually worked hard and recovered in how many months?
For us, unfortunately, in India, we see a lot of knee dislocations. Knee dislocations are injuries where your entire bones come apart and therefore you break everything. And we see this primarily with motorcycle accidents. We see it with people falling off local trains, people falling off from heights. So it's usually a high velocity injury. We also see it sometimes in sports, but the sports ones are what we call as low velocity knee dislocations. So those are not that bad. Now, when you land up with these high velocity injuries and you reconstruct them, for that kind of injury, typically it would take about 18 months. If someone doesn't do rehab, it could take 2 to 3 years also. His was an unusual case because he's an athlete and had a high velocity injury. His was demanding because his demands of what he requires in his sport it's a difficult sort of procedure. You need to then get back full movement. You need to get back full strength. You need to get back full stability. You need to make sure that the fitness is there. You need to make sure that in that whole process, the mental conditioning is going on because, such a long process. One day you're a super athlete and then the next day you're completely down. So then the mental conditioning aspect of it, taking care of nutrition and diet and making sure that you don't put on too much weight in that process. So multiple things need to be done. But if everything goes off well, then you get a case like Rishabh, where he's excelled in his return to sport post such a major injury.
So how much role did his own mental grit and resolve play in all this?
It's very important. So as a patient or as an athlete, if you don't have that will and you don't want to do it, then it's going to be impossible for the people around you to achieve their aims. It's like someone who wants to leave alcohol. He's an alcohol addict, and if he truly doesn't have the intent and he doesn't have the desire to do it, no matter what you do, he's never really going to stop alcohol or he's never going to stop smoking. So you need to have that intent in you. You need to have that strong desire in you. I think what was important and what was really beneficial for us as his treating doctors was that Rishabh's intent was absolutely solid. From the day that I met him, I think he realized that, look, something bad has happened. I need to put that behind me. I need to now see a path forward and I need to see the steps that I require to do to get me back on the field and get me back to the way I was prior to the injury. Some of his teammates, I think the mental conditioning that they gave again was very important. Teammates who came in to meet him at the hospital and to tell him that, look, I underwent the surgery. I was probably in the same room as you are, and I'm fitter or faster or better now after my surgery and my rehab than I was prior to this. And you can probably get back to that same state. So all of that encouragement, all of that light at the end of the tunnel ensured that he could stick through it. And the good aspect was his patience. In any surgery like this, initially you need to be a little patient. You need to wait, allow things to heal, and then accelerate the sort of loads that you put onto those reconstructed tissues. So he did it in that phased manner and did it perfectly. So there's an optimum, and he achieved that optimum.
So, of course, his was a case which also was related to an accident. But in general, talking about elite athletes, what kind of injuries do they come with?
So most elite athletes will have either of two injuries. One is what we call as the traumatic injuries, something that they can't control. So you have a wrestler and you have an opponent. That opponent, holds your shoulder and dislocates it. There's not too much that you can do. you are, fielding and you have a ball that comes and hits you, there's not too much that you can do. Or, these are traumatic injuries. You're a footballer, you get tackled, there's not too much that you can do. But you've also got the second, which is overuse injuries, and that's because of too much effort. You're a swimmer and you're training hard and you really want to do better, and you increase your workloads and you're increasing your cycles of load tremendously more than what your body is used to. And that's an overuse injury. So that's repetitive, minor, repetitive overuse, and then that lands up with an injury. So you've got two different sorts of injuries, and then both require care, not always surgery. A lot of these injuries can be treated with just rest and rehabilitation.
Okay.
But sometimes the overuse injuries are more frustrating because as an athlete, you often blame yourself. I've caused this to myself, and sometimes they blame their coaches or their support team, saying that, maybe, you guys, did too much to me and too early. So you need to manage this, and it's a delicate situation. So in these kind of injuries, you need to manage it and manage all the stakeholders with some amount of, delicacy here. And then once you've done that, then get them going on their path of recovery.
But tell me, you've treated almost all the top athletes, from the Sunil Gavaskar to Bumrah to Saina Nehwal to Neeraj Chopra to Rishabh, Pant, and so on. And you've been a sports enthusiast. So for you, was there ever a fan moment? Somebody that you really admired walked into your clinic, and what was that moment like? Did you ever?
I think all of these athletes, so all of these elite athletes, guys who are representing the city of Mumbai, guys who are representing our state, guys who are representing India, all of these elite athletes, I have the deepest sort of respect for them. So where they've come, even in a difficult situation in India, to excel in sports is not that easy.
Right.
It's quite a grind.
Yes.
And it's a difficult process. And to be able to achieve that is not easy. And once they've achieved it, they're certainly special. So I have the deepest respect for all of them, not just our elite athletes and not just our cricketers and our Neeraj Chopras, but our players who are, junior players. He doesn't necessarily have to be a winner, but just the fact that he's competing, he's there, he's putting in all his effort. Yes. I have the, sort of deepest respect for them. So I'm a fan of all of these athletes. I really admire the way that they're putting in their effort in trying to achieve their goals.
So one, they're putting in their effort to achieve the goals. The second is that, even when they get injured, what we see is just their miraculous or whatever celebrated comeback. We don't really get to see those months of those silent work which they put in. And I think for athletes, it's not just about the pain and the actual physical rehab. It's a mental trauma also they go through, because they worked so hard for one particular tournament or one particular event, spent 2 years, and then just one injury and they're not able to participate. So the kind of mental trauma.
Tremendous. I mean, sometimes it's an injury, but sometimes it's an infection. Some of our best athletes, land up. Take H.S. Pranoy, for instance.
Right.
H.S. Pranoy had a fabulous year in badminton. He did so well for the country in the Thomas Cup and in so many other events. I mean, fabulous year. And then unfortunately, 3 weeks before the Olympics, he landed up with chikungunya. Now, there's not much that you can do. So you've prepared for the last Olympic cycle, 4 years you've prepared, you've really, sweated it out in order to get qualification. This is a moment that you've probably worked for your entire life.
Yes.
And then something like this comes in, something that's way beyond your control. And, hats off to him that he did manage, and he did manage to recover so quickly, and he did manage to get through the qualifications. I mean, so that's inspiring. That's inspiring, not just to other athletes, but to all of us, healthcare, sports doctors who take care of these athletes, that, sometimes these things happen, and these are extremely traumatic, not just physically, but also mentally.
Yeah.
But these athletes manage to overcome these setbacks and then move forward.
Yeah.
And that's what life is all about.
Yeah. You were also part of the recovery journey of Neeraj Chopra, Olympic gold medalist. I feel that, someone who was almost carrying the weight of nation's hopes on his shoulders. what was that process like, and what stood out of from his mindset that really kind of impressed
I've
you?
known Neeraj since quite some time,
Okay.
since he was a junior world champion.
Okay.
Neeraj had come to me for some minor sort of injuries. And so prior to the Tokyo Olympics, when he had the elbow injury that required surgery, again, that was a tough time for him because he had an injury. Initially, thought he could pull through with it. And then when it was absolutely impossible to throw and his elbow got locked, we had to take the decision for surgery, do it quickly. We didn't have much time for qualification at that point of time because the Tokyo Olympics were set to be in 2020. We thought we really needed some time, and that surgery went off well. His rehab went off well. And then he did get qualification again in really good time. And fortunately, the Olympics got a little delayed, so he could really work on his fitness, and then came in and got that historic, legendary gold for India.
Yes.
But I think that's a learning process. You land up with an injury, but that doesn't mean it's the end of the world. And he didn't treat that as the end of the world. He just treated that yes, things happen in sports. He kept that as his goal. That gold medal at the Tokyo Olympics is going to be something that I need to target. And initially itself, he was very, very clear that I need to know all of the steps in order to get there. So if step 1 is surgery, and step 2 is the healing process, and step 3 is the rehab, and step 4 is the fitness, and step 5 is the coaching, and then improving in my fitness, am I going to get there? And I think that's the positivity that we need to give them. That yes, we can get you there if each of these steps goes off well. And I think his self-belief again was tremendous. And truly that one event has changed the way Indian athletics has been for the past many years.
Absolutely. Yeah. But, we're talking so much about rehab. Does India have enough high quality rehab centers, especially for these elite athletes? I mean, something through which we can actually increase the longevity of their sporting life.
We do now. For many years in the past, that was something that we didn't really concentrate on. I think we didn't understand the importance of sports science, that our athletes can only do so much. They need the backing of sports science, and that sports science has to be preventive. There has to be a sports nutritional aspect. There's got to be a mental conditioning aspect to it. There's got to be a fitness aspect to it. There's a rehab aspect to it. There's a post-surgical recovery process to it. So there are many, many aspects of sports science. And I think in the past, we just believed that our athletes would, win themselves accolades through their skills. But the world's changing, and we know that, there has to be a scientific process to it. And so the last 15 years, we've got a lot of good sports science centers that are all across India that are coming up, both in the government sector, also in the private sector. And I think that the difference now between sports science centers in maybe India and the rest of the world, that difference is really minimal.
Oh, okay.
We do have the manpower, we do have the know-how. What we don't really have to that extent is good sports research. So our research in sports science is still a little lacking. And therefore, what we often do is based on what's there in evidence in international literature. I think it's important that we also develop systems where we can have our own sort of sports sort of research going on, not just in sports science, but also in sports biomechanics and in sports performance. And when that comes, then I think that's going to be the real next step and the fillip that we require.
And which are these good rehab centers? For example, where did Rishabh Pant go to?
So Rishabh Pant did most of his rehab, initial rehab at our hospital, at the Kokilaben Dhirubhai Ambani Hospital. And then he went to the National Cricket Academy in Bangalore.
Okay.
So the NCA in Bangalore has a fabulous sort of setup for all of our cricketers. And all of our cricketers are contracted, and the state level cricketers will do all of their rehab at the National Cricket Academy. For athletes who are not cricketers, you've got other avenues. So you've got multiple other sort of areas. So JSW Sports has their own large rehab center in Bellary that is there for their sportsmen. So Neeraj Chopra did all of his rehab at JSW Sports following his surgery. So like that, in Delhi, in Kolkata, in Indore.
Okay.
So you've got multiple rehab centers now in many places.
When we talk of rehab, the in thing now being talked about is everything to do with hydro. So, does that really help?
It helps. It helps. So, we've always known that if you had to put a lot of load on the joint initially, so say you've undergone a surgery, you put some ligaments in there, those ligaments are healing, so we don't want too much load on them in that early initial phase.
Right.
So you're losing out some amount of time before you can really load it. But if you can get that athlete into water, so you've got treadmills now which are in water. So we call these aqua treadmills. So you've got separate treadmills that are anti-gravity. So we call these alter G sort of treadmills. So you could actually run, but you're not at full weight. You can actually modulate that weight and the sort of loading that goes in. So you're starting off exercises, you're starting off the recovery process for those muscles without hampering your healing process of surgery. So since you can do that early, you're then able to get back your goals maybe 6 weeks, 8 weeks faster than what you would have otherwise gotten back to, and could mean a lot for an athlete.
So what aqua helps you do is that it helps you exercise without putting that load on.
Without excessive load. So in water, you're buoyant. So because you're buoyant, you're not putting that excessive load. And so exercises in water are always going to be good for joints. So say someone is obese and wants to lose weight, and if you're going to jump 100 times on land, that's going to be a lot of load. But if you jump in water and that water is up to your chest level, the load on your joints is not going to be that much. So aqua aerobics becomes preferable till you lose a little bit of weight, and then you can maybe do land aerobics. So all of the treatments that take place in water is then good for that recovery process.
So we spoke about orthopedic care in that sense for the elite, whether it's athletes or whether people living in the large towns and cities and so on. But what about the general population in the rural areas? How accessible is good quality orthopedic care for them, and how can we make that better?
Orthopedic care actually is good enough.
Okay.
So general orthopedic care, we've got a lot of good orthopedic surgeons all across India. So we've got a Indian Orthopedic Association, our IOA, and we've got thousands of good orthopedic surgeons, and they're not just in the cities, they're in tier 2, tier 3 rural areas also. So orthopedic care for, say, fractures, for basic sort of orthopedic things is existent all over. So I think that's great. What we have a lacking of is sports orthopedics. So we're trying, Indian Arthroscopy Society that takes care of sports injuries, and Indian Association of Sports Medicine is trying to train more and more young sort of doctors and physiotherapists into getting into the rural areas. Because if you see the way our sports is going, there's a change. If you saw our Indian cricket team 20 years back, where did those cricketers come from? And if you look at our Indian cricket team now, and where are our cricketers coming from, it's not necessarily the cities.
Right.
It's areas that are smaller areas, and that's really where a lot of the talent is. That's where a lot of the hunger is. And that's where a lot of our athletes are going to be coming from in the future. So we need to ensure that all of these areas are also covered from sports science, from sports rehab, from sports orthopedics, so that if injuries take place, they're well treated. We don't lose out on our budding athletes and promising athletes just because there wasn't adequate treatment or rehabilitation available at his place.
Let's talk about your journey, through this whole process. So you are always handling such of, most of these celebrity cases. In a way, the nation watches their recovery. So in a way, they watch your performance. How do you handle that pressure, that media glare, and so on?
A lot of these athletes may ultimately be celebrities and they may be superstars on the field. But when they come into the hospital and they come into, my rooms, they are no different from anyone else. These are all human beings who have been injured, and all of them are human beings who have aspirations on getting back to normalcy.
Right.
So when they come in, I don't really differentiate from a cricketer or a swimmer or the recreational footballer or to the kid who's fallen down to the taxi driver who's injured or the layman who's fallen off the train.
Yes.
So all of these to us at the end of the day are patients. They're all human beings. And as doctors, I think if we don't differentiate, then we can get a sort of balance.
Agreed.
So for me, anyone who walks through that door and who requests me for treatment, I'm going to treat him with the same sort of respect and with the same sort of needs. So I think that makes sure that I don't unnecessarily pressurize myself too much in, who this person is and what I'm treating. And I think that's easiest then for me.
So in your journey, is there any, or rather, which is that one case or surgery that appeared to you to be the most complex or most memorable? And I'm not talking of just the elite athletes, just anybody. Something that stood out to you as being very, very complex.
There's so many injuries that we see. Sometimes these injuries are so complex, multiple structures getting injured all at once. More than 2 joints getting injured all at once. So we see quite a few of them. And there's so many that come to mind.
Okay.
The one athlete that I can probably think of in that respect is Vinesh Phogat. Vinesh Phogat's a wrestler. She's struck me as one who has had grit. So she had an injury, a very, very serious knee dislocation injury on the mat in Rio, in the Rio Olympics. And this was on her right knee, and she underwent multiple ligament reconstructions in that. An injury like that in a wrestler, typically we wouldn't have expectations of someone coming back to sports. But within 7 months, she won the silver medal at the Asian Wrestling Championships. And within 2 years, she won the gold medal at the Commonwealth and at the Asian Games. And she was, I think, world number 1 at that stage after such a major injury. And then after the Tokyo Olympics, she came in with an elbow injury and required an elbow surgery. And that elbow surgery went off well, and then she got back again. And then just before the Paris Olympics, she had her opposite knee, her right knee, which landed up with an ACL tear. And she underwent an ACL reconstruction there, and then managed to, we would normally say 6 months is the average. She managed to, overcome everything and qualify despite the injury and the surgery and the rehabilitation within 4.5 months. So miracles happening again and again and again is not that typical. And especially in a sport like this, you have to have extreme sort of grit to be able to achieve that. So I think that for me is, a memorable sort of situation. Multiple different joints getting injured and still managing a long career in a sport which is not that forgiving.
Yeah. Anything that you remember of somebody of an old age where kind of the recovery surprised you? Because generally you believe that you become old now, as long as you can walk after a few months, it should be okay. But somewhere the recovery exceeded your expectations.
Absolutely. I think this just happened a few days back. A few days back, someone that I know and who is very dear to me, 92, but extremely fit and still walks and has walked all of his life. Unfortunately had an injury to his knee. And I wouldn't have expected him to be walking with his walker, with the brace, within a month. But such grit and such enthusiasm to make sure that you get back to your walking and you get back to your fitness has ensured that just a few days back I saw him with his walker, walking up and down, relatively pain-free. I'm sure he wasn't completely pain-free, but being so positive and knowing that, yes, I'm 92, I'm 93, but I still want to walk. I still want to get back to my morning walks. I still want to be completely fit. I think that's really inspirational.
Yeah, that's so inspiring for everybody. That
Absolutely.
You don't need to give up, even if you think you've reached 80 or 90 or so on.
Yeah.
So for the young doctors who are listening to this, many doctors, and you did the same thing, get trained abroad, the best of facilities and so on, but then they come back to India to practice. How difficult or easy is that transition?
I think that transition is a challenge. There's no doubt that transition is a challenge because healthcare systems are different in different parts of the world.
Yes.
In some parts of the world, especially if you've trained in the West, where a doctor's responsibilities is just this much and not extending to other parts of patient care, and you're used to that, and if you're used to that for a long period of time and you plan to come back to India where our patients expect, everything from their doctors. So the doctor's not just the guy who's going to fix their joint, but who's going to answer all their questions
at any hour of the day.
At any hour, is then going to help their mother with her problems. So a lot goes into treating a patient.
And answer the wife who's probably read a lot on internet and then asking questions.
True.
Yes.
So there's a lot that goes into treating a patient, especially in India. And so your mindset has to be a different sort of mindset. Besides that, our workflows in hospitals, in the outpatients, in the operating rooms is slightly different. And so if you're used to a particular system and you're used to it for too long, then it may be difficult at a later stage in life to try and relearn and adapt. I think that's a big challenge. So if you're out for too many years, I think that's difficult. But if you've made up your mind in the initial stage itself that, okay, I've done my training here, I know the system here, I'm going to go wherever I'm going to go just to get a different sort of outlook and try and pick up certain skills and try and learn on some technology that's not available here as of now. It's going to be for a year, 2 years, 3 years, or 4 years, and then I'm going to come back. Then you've always got that mindset that I will be back here and this is what I'm going to do.
Then your mindset is working that way. And then you're not taking such a long break. And of course, a doctor's schedule is known to be unpredictable. So tell me, how do you take out time for your family?
That sometimes is a little tough. In medicine, unlike many other branches where you have the moral right to say no, an accountant or a lawyer or anyone could say, no, I've got enough on my plate. I can't take you on as a client and because I'm already full. Unfortunately, in medicine, the way our ethics and our etiquette works is that we are almost never allowed to say no. And so when our patients do come in, it becomes difficult for us to say no. And so when we can't say no, then things keep piling up. And when it piles up, sometimes getting the right balance is a challenge. And I think that is a challenge for me right now also. So when you have patients who do have major demands on your time, it does cut away from the time that you'd like for yourself and for your family and your other needs.
But therefore, there's that passion for your profession which keeps you going.
If you don't have that passion, there's no way that you could do it. There's no way that you could do this day in, day out, 14 hours, 16 hours, 18 hours, on a regular basis, year after year and decade after decade. That's not going to happen if you really don't want to be there.
And the last thing, everybody's life or journey is in that sense very unscripted. Unexpected moments, unexpected events happen. In your life, whether personal life or professional life, was there any one of those unexpected moments that happened that you never thought it would happen, but in a way that changed your life substantially?
I think all of our lives will have something like that. The most recent one would be me getting back to competitive swimming. So I used to be a competitive swimmer as a child, and I used to swim a lot. And then in my medical years, I swam for my university. And then towards the postgraduate years, there was absolutely no time to swim at all. And so for maybe 25 years, I hadn't entered a pool, not for any sort of serious sort of swimming. And then about a year back, one of my friends gave me a call and said, we require you to come and swim for our team. And we're missing one of our members for the relay.
Okay.
And we swam as children together. I went in for that swim. It was a competitive inter-club event and did surprisingly well.
Wow.
So, and then I thought, why not continue with that?
Okay.
And so then over the last year, I've slowly tried to get a little bit of time, maybe 2 Sundays in a month or 3 Sundays in a month, where I keep, sticking at it and trying to improve myself and get back my sort of old levels of fitness and getting back to competitive swimming. 2 years back, I would never have imagined that I would be swimming competitively, at the age of 56. But, it's there now. So I think that's an unscripted sort of event that's taken place, and hopefully that's going to improve.
Absolutely. Yeah, this is a unknown fact, but you're right. So, you can with passion follow your profession, but at the same time, take out time for something like
the
this.
stuff that you really
yes,
love.
Yes. Absolutely. So now we come to the last section of my episode. And that is, I'll ask you some quick questions and you give me impromptu answers to those questions.
Okay.
So, one sport you wish you could master?
For now, swimming.
So we are going to now keenly watch you on those competitive events. After a long surgery, a coffee or a chai?
Neither. Just water. I love water. I like to hydrate myself really well. So I don't drink coffee or chai. I drink lots and lots of water.
Oh, okay. So that's really a doctor speaking. That in fact reminds me that sometimes if I've told somebody or somebody has said that, my knees are hurting, the one advice that I've got is just make sure you drink enough water, because keeping the hydration going itself takes care of...
It's critical for the body.
Yeah.
Absolutely.
Yeah. Your orthopedic pet peeve, something that very small it could be, but something that irritates you either in the clinic or in the operation theatre.
I think the clinic, it's usually we would go through what the problem is and what the treatment is, and then we'd answer all of the questions of the patient. And I'm perfectly okay to answer those questions the second time also. But when the same question gets answered 3 or 4 different ways because the patient wants that particular answer which you're not giving them, then at some point of time, I'll say, I understood it, but that's not the answer. I'm going to tell you what the truth is, but that's what it is. So that's my pet peeve. I think at some point of time, you need to realize that you're getting the answer that's there, but it's not the answer that you want. That's what it is.
Yes. Okay. Music you'd love playing in the OT if you were up to it?
A lot of surgeons like music in the OT.
Yes.
I don't.
You don't?
I don't. For me, when I'm doing surgeries, I'm completely zoned in.
Okay.
And all of my concentration is just at that task at hand. At that point of time, no phones, no ringing of bells, no music. I'd like everyone in that team to just concentrate on that task at hand, because sometimes in surgery, one little step here or there is irreversible, and you can't allow that.
Yeah.
And so if you want that perfection to come in, then you want everyone really to concentrate completely. Therefore, pin drop silence, no music.
If you weren't a doctor, what would you be doing today?
Something in sports for sure. I loved sports, and sports is my passion. It still is. It'd be something in sports, administration, coaching, something in sports for sure.
And as you said, even at the age of 92, if people can recover, we have a long way to go.
That's a great learning experience.
If you could swap lives with one athlete for 24 hours, who would that be?
There's so many inspiring athletes, Sachin Tendulkars and Rahul Dravids, who've not just been so fabulous on the field, but as good human beings have made such a change in society around them. Someone like that, or someone for their sporting performance, Usain Bolt, just to be able to run at that speed, to experience what that feels like, or Michael Phelps to be able to swim with such perfect technique and glide through that water. I mean, what it would feel like, that would be a great, great experience.
One myth or half-truth about orthopedic health that you wish that people would stop believing?
I think excessive calcium intake. A lot of patients self-medicate themselves with calcium all the time. And we know that excessive calcium is really deleterious. It's harmful to the body. It gets deposited in the coronary arteries and where else. And so unnecessary calcium, dietary supplements is something that I think you should avoid.
And what kind of issues can it lead to actually?
Calcium, I think the worst part is that it could result in our coronaries, our heart arteries start developing calcium deposits and plaques.
Yes.
And I think that would be the worst sort of effect that it could have. You could get other calcium deposits elsewhere that may cause pains, etc., but won't kill you. But this could actually kill you.
Yes. 2 simple daily habits that can increase the longevity of our joints and bones.
Keep moving. So I think walk, move. Movement is important. If you need to get from place A to place B, a little bit of exercise would be just the steps that you take. I think that's important. Also working on flexibility. You don't necessarily have to do yoga or do some stretching exercises, but good flexibility is going to help your joints. As we grow older, it's a natural process for our joints to get stiff and tight. If you can do some basic, simple flexibility exercises for your back, for your joints, that's going to help you in the long run.
Okay. Two dietary habits or nutrients which are critical for joint and bone health?
I think for bones and joints today, the two sort of things that I would say would be number one, vitamin D.
Okay.
We find a lot of patients being vitamin D deficient, which then affects their bone health and affects their muscle health. I think the second would really be hydration, water. Making sure that you hydrate yourself adequately is going to ensure that none of the problems that take place to your muscles keep happening. Muscle aches, cramps, etc. just happen because of inadequate hydration. Primarily with athletes, recreational and competitive, but also with normal human beings walking around who are not just drinking enough water.
So how much is enough water?
I think the minimum that you should be taking is 2.5 liters a day. That's the minimum. But if you don't have a condition that's affecting your kidneys or your heart, you could straight away go up to 4 and 5 liters. And if you're exercising and losing a lot in sweat, then I think you need to compensate for that too.
Okay. And when you said vitamin D, I mean, what are the ways of getting vitamin D? Is it the sunlight? Is it the natural food, or is it the supplements?
Traditionally, the best sort of vitamin D is sunlight. So our skin cells in the skin will convert the sunlight into vitamin D precursors. But unfortunately now with the changing environment, or whether it's the ozone layer or whatever it is, we have a lot of our athletes who are out playing in the sun all day and who still are vitamin D deficient. So I think some amount of constant vitamin D supplementation is important for you. And taken in limits, it has no real side effects. So maintaining optimal levels of vitamin D is, I think, worthwhile for anyone. Now, in countries abroad in the West, especially those that have darkness and, in the northern areas, you've got vitamin D supplementation in milk and in bread and in all of your daily sort of diet. So if you're not taking a diet that's supplemented with vitamin D, it might be worthwhile for you to take a little bit of vitamin D supplements, even just once a month. Make sure that your levels are good enough.
And keep checking it also on a regular basis.
If you could, that'd be great. Even if you don't want to check it, vitamin D supplements are relatively safe when taken, in limits. So you can just keep taking regular vitamin D even once a month. A small capsule once a month is going to make sure that your vitamin D is adequate.
One health tip that you often give to your patients, but you don't follow yourself?
I just wish I could exercise more. My time limitations limit the amount of exercise that I do. I do know that if I exercise more, I'm going to be fitter and I'm going to be able to help my patients for a longer period of time. But that's a challenge. Sometimes finding the right balance is a challenge, and I just don't do as much as I'd like to do.
On that note, thank you so much for being here. As we've gone through the conversation, what you've really told us is that whether you are that athlete who's aiming for a medal, or whether you're just a normal person wanting to live a pain-free life, your joints, your bones, your muscles are very, very important part of your body. And we must prevent issues there. And if we haven't prevented, then we must cure them well. But all of this is about, making the right decisions on a daily basis. Your right diet, your right weight, your right amount of exercise, your right amount of supplements, the balanced and the optimum approach, as you said. So
keep moving. Keep moving. If you keep moving, I think you're going to keep enjoying what your body can offer you.
That's right.
Thank you, Chanda.
Thank you so much.
It's been a real pleasure to be here this afternoon.
Thank you.